This is the third part of Childhood Disorders for Behavioral Science and Psychiatry for Falcon Physician Reviews. This is the third part of Childhood Disorders for Behavioral Science and Psychiatry for Falcon Physician Reviews. In this section, we'll be talking about IQ, childhood disorders of psychiatric origin. So what is IQ? IQ is your mental age divided by chronological age times 100. And the highest chronological age used is 15. So IQ is not academic achievement. It is actually a predictor of academic achievement. It doesn't indicate whether or not you're going to achieve. And on a bell curve, the median IQ is about 100. Mental age is the median test score for a given age, and the standard deviation of IQ is 15. So your IQ generally stays stable after the age of 5. And as I said before, an average IQ is about 100, but a physician generally has an IQ of about 120 to 140, just to give you a rough estimate of how IQs pan out. And someone who has mental retardation will have an IQ of 70 or below. They will be 2 standard deviations below the median. So if you look at the different IQs, an average intelligence person is between the IQ of 90 to 110. Borderline to low average intelligence is between 70 to 90. Mild mental retardation is from 55 to 70. Now, these are questions that have been asked on the USMLEs. If you have mild mental retardation, how much can you function? These guys can function pretty much like normal adults. You might have seen them at the grocery store bagging your groceries. They'll go to school. They won't be highly productive, but they'll learn how to take care of themselves. They can speak. They can function pretty much independently. Then you have moderate mental retardation, which is IQ of 40 to 55. Again, these guys won't be very, very high functioning, but you can teach them how to take care of themselves. You can do some minor jobs, maybe things that are very simple and repetitive. They would probably live with their family just because of financial reasons, but they wouldn't need their family in particular to take care of their every single need. Then you have severe retardation, which is from IQ of 25 to 40. And these guys have a little or no speech, and they need supervision. And they need help with their day-to-day functioning. They can't hold jobs. They will need to have supervision most of the time. Then you have profound retardation, which is under 25, and these guys need constant supervision. They won't have any speech. They can't do anything for themselves. They will need to be in a group home setting where someone can take care of them all the time if the family cannot. So what is mental retardation? As we said before, it's having an IQ of at least 2 standard deviations below the mean and in an impairment in at least 2 of the following compared to their normal peers. So they have to have an impairment of either communication, self-care, home living environment, social or interpersonal skills, the use of community resources, self-direction, academic skills, work and leisure, health and safety. So at least 2 of those, as well as an IQ of 70 or below. So how do you test IQ in kids? And there are 4 different tests. And if you use a WAIS, which is the Wechsler Adult Intelligence Scale, you have to be ages 17 or older. Commonly used IQ test. And how will you remember this? The WAIS has an A in it, so that's for adults. So that's 17 and older. Then you have the WISC, or the Wechsler Intelligence Scale for Children, WISC. And this is for children ages 6 to 17. Again, how will you know that this is for children? Well, WISC has a C in it, and that's for children. Then you have the Wechsler Preschool and Primary Scale of Intelligence. So this is for the ages of 4 to 6. How will you remember this? Well, what are the average age of kids who go to preschool? Between the ages of 4 to 6. So that's how it would be the most easiest way for you to remember this. The Stanford-Binet, which is one of the first formal IQ tests, can be used from the ages of 2 to 18. So on your exam, if you have anyone below the age of 4, then you'll know to use the Stanford-Binet. But for all the other ones, look at the ages, and then you can match them up with a different IQ test. So there are different causes or medical causes of mental retardation. Now, in Down syndrome is the most common genetic. See that the word genetic is underlined because that's going to be your buzzword on your exam. And that's the most common genetic cause of mental retardation. It's a very high yield question. Also, Down syndrome is the most common cause of mental retardation. It's trisomy 21 in 95% of the cases. These kids will have a very characteristic faces. They will have a round face, a flat nasal bridge, they'll be short, they'll have up-slanting palpebral fissures, they'll have hypotonia, their tongue will be protruding, and they'll have the transverse palmar crease as you see in the picture. But they're generally very happy children. They can sometimes live independently. These guys you'll frequently see working in the grocery store. 40% have congenital heart disease, and when they get about 40, 45, 95 to 100% of these patients will eventually develop Alzheimer's dementia. So on your exam, if you have someone very young, 35, 40 with Alzheimer's, you know that the person probably has Down syndrome. Then you have Williams syndrome, which is a deletion of chromosome 7. And again, these kids also have a very characteristic faces called the elephant face. And if you look at the child in the picture, you'll notice, again, the flat nasal bridge, the large forehead, his teeth are very widely separated, the low-set ears. That is what the elephant face is. They'll also have a starburst iris, hypertension, and aortic stenosis. These children are actually very well known for their musical ability. Then you have Fragile X. Now, as we said before, Down syndrome is the most common cause of genetic mental retardation. Fragile X is the most common cause of inherited mental retardation. So here again, the buzzword is inherited. The illness is found on the long arm of chromosome X. And as you can see with this young man, he has a very characteristic faces of the long face, the prominent ears, and they'll have macroorchidism, which means they'll have large testes. And 80% of these children will have ADHD, or attention deficit hyperactivity disorder. Next is Prader-Willi syndrome, which is a deletion on chromosome 15. These children are the very short stature, they're hyperphagic, which means that they will eat anything in sight. They're obese, hypogonadism, and the problem with these kids is that they're always hungry and that the parents actually end up locking all their cabinets and locking their refrigerator so these kids cannot eat. Very difficult to treat this illness. Also, characteristically, these children have almond-shaped eyes. The next kind of mental retardation that you'll see is fetal alcohol syndrome. And this is the third most common cause of mental retardation, and it's probably the most common preventable cause of mental retardation as well. Next, we'll go to our pervasive developmental disorders. There are 3 types of pervasive developmental disorders that are going to be discussed here. First one is autism, second one is Asperger's, followed by Rett's. So in autism, you have to have an abnormal functioning in social interaction, language as used in social communication, and there has to be symbolic or imaginative play. So these all have to occur before the age of 3. So what does a child with autism look like? This child has very poor verbal skills, will frequently repeat what you say over and over again. They will get stuck. Like if you were to give them a toy such as a car, they would get stuck at looking at the wheel, and they would just look at the wheel over and over again and would not be able to move from that toy to another toy. And if you were to take that toy away, it would get very, very upset. They also don't come and get affection from their parents like a normal 2 or 3-year-old. They won't come and give you a hug. They generally are isolative. They like to play by themselves. Also, when they get very upset, they have these characteristic flapping behaviors of their arms, and they'll move them up and down to show that they're in sign of distress. They're very preoccupied within themselves, have very little communication with the outside world. Asperger's disorder is very similar to autism, but in Asperger's they must have a normal IQ, and they have an impairment in social interaction. Their language will be completely normal, whereas we discussed with autism they won't have any language for social interaction, whereas in Asperger's they will be able to talk fluently and interact, but they won't be able to interact with social cues. So a person with Asperger's won't be able to maintain correct boundaries with people. Say if someone doesn't like them, they won't get the cues, the social cues that, hey, you're irritating me, stay away from me. Also, the Asperger's patient, just like the autism child, will have the repetitive and stereotype patterns of behaviors that get fixated on one specific thing and talk about it over and over again. Again, their IQ will be normal and there will be no language developmental problems. The last of the pervasive developmental disorders is Rett syndrome. And Rett syndrome is very similar to autism, except that this is a normally developing child. Their perinatal development is normal. Everything is normal. And then, until about the age of 5 months of age, suddenly there is deceleration of their head growth, and they won't have normal social cues. Generally occurs in females. This is an X-linked disorder. They will also have the stereotyped hand wringing behaviors, be more hand washing, and seen mainly in girls. You can see it in boys, but they have to have the XXY genotype, and since that's not very common, you don't see it in boys. But it is very, but it's most commonly seen in the females. And again, remember with Rett syndrome, there has to be the deceleration in the head growth and the characteristic hand-wringing behaviors. So what are the treatments for pervasive developmental disorders? First of all, because these guys have a really hard time with any kind of social interaction, autistic children have difficulty with language, the first thing you want to put them into is occupational training and speech therapy. So those are going to be your primary issues that you want to deal with these kinds of children. But sometimes these kids can become very aggressive, they can hit, they can have self-mutilating behaviors. Right now there is one antipsychotic medication that has been FDA approved for treatment in autism and aggressive children, and that's risperidone, and that's an antipsychotic medication. You can also use mood stabilizers, and antidepressants are sometimes used, but there is one FDA medication, risperidone. Next we come to learning disorders. And what learning disorders are is that achievement in a specific area lower than the perceived ability given patient's IQ and education and their age. So what this means is that this is appears to be a normal child who was doing fairly well in school, getting fairly good grades, but he's just doing really bad in reading, or he's just doing really bad in math. And there are different types. There's learning disorder not otherwise specified, reading disorder, disorder of written expression, mathematics disorder. This is very common in males. And when do you think of someone having a learning disorder? So say again, like I said, you have a child that's doing well in all their subjects, but they're really having a hard time with one specific subject. What you can do is you can do a WISC on the kids and do an IQ test, and what you'll notice is on different parts of the WISC, there'll all of a sudden be a drop off in a particular area, whether it's the math portion or the reading portion, and that can give you a clue as to, oh, this child must have a specific learning disorder. And how will you do a differential diagnosis of learning disorder? Well, first you want to make sure that there's no pervasive developmental disorders such as autism, Asperger's. You want to make sure that the child doesn't have any medical problems, like can he read the board okay? Can he hear what you're saying? Usually this occurs much younger. You'll notice a problem with the child much younger, but if you've got a kid in the back of the room squinting because he can't see the blackboard, well then that can kind of clue you in. And also any other factors that will inhibit access to quality education, such as is the teacher not good, poverty, is a child just moved from a new country and they can't understand the accent or don't know English very well. So you want to eliminate all those other factors before you diagnose them with a learning disorder. So what are the risk factors for learning disorders? We want to rule out any neurological disease or injury such as cerebral palsy, which can predispose children to learning disorders, seizures, things like that, which can cause neurological injuries. Also, drugs or toxic exposures. Say if you have a child that's been doing well, lives in an old house with chipped paint, think about lead poisoning because it slows down their cognitive abilities, makes it difficult for them to learn. And also, you want to do a detailed history with the family. Ask if there's anyone in the family who has a history of a learning disorder, as learning disorders usually run in the family. As we discussed earlier, how do they present? Again, they'll have problems in a specific area. It usually won't be a global problem, it'll be a specific problem. And the kids will have school failure, they might show symptoms of ADHD, poor self-esteem, and behavior problems might also be present. How do you manage this? You want to confirm that they have a learning problem, and you will again do an IQ test and you'll see where they have the most difficulty. And what you can do is that if you know that a child has a specific problem in math or reading or written expression, you can inform the school and they will do remedial education of that subject and have learning strategies. So what they can do is put a child on a one-to-one with the teacher at that time, or they can give the child more time to take a test on their own in a quiet environment to really help them overcome this learning problem. And some patients will have persistent problems in adulthood and impairment in occupational functioning. Next, we'll go to attention deficit hyperactivity disorder, probably the most commonly diagnosed illness in children and adolescents. So to have attention deficit hyperactivity disorder, you have to have both inattention for 6 months with 6 or more of these following symptoms, and you have to have hyperactivity and impulsivity for 6 months of 6 or more of the following symptoms. So in inattention, you have to be careless, you don't listen, you don't follow through with your instructions, you can't finish homework, you don't turn it in. These are the kids that are losing their homework. They've done it at home, but for some reason they don't give it to the teacher, they can't organize, they're forgetful, easily distracted, can't stay on task. Then your hyperactive symptoms are the kids that can't sit still in their chair, they're fidgety, squirmy, run around, can't be quiet, they're on the go, and talking excessively. These are also the kids that are sitting at the class, and when someone asks a question, lifts up their hand, shaking it wildly, they can't wait till it's their turn to talk and usually interrupt other people. So once you've looked at the criteria for ADHD, these children must meet the criteria before the age of 7 years old. So frequently we will get adolescents who come in and say, I can't concentrate in school, I'm not getting good grades, I need some ADHD medication. And if you ask them, when did your symptoms start? They'll say, oh, it just started this year, I did fine in middle school, I had no problems, I never got in trouble. And what the problem is that when they get into the adolescence, there's the stress of going to college, doing well on their SATs, so they want some kind of medication to help them along. So it's very, very important to get a good history of when the symptoms started, if they started before the age of 7. And there also has to be, all these symptoms have to occur in more than 2 or more settings. It can't just occur at school, it can't just occur at home, it has to occur in multiple different areas of their life. It also has to show a clear evidence of significant impairment in their social, academic, and occupational functioning. And for a child, occupational functioning would be their school functioning. It does not occur exclusively during pervasive developmental disorder, schizophrenia, or psychotic disorder, and it's not better accounted by another mental disorder. How do you treat ADHD? The first line of treatment for ADHD is psychostimulants. You'll use methylphenidate or Ritalin-based medication is commonly used. There are longer-acting forms such as Concerta, Metadate CD, Ritalin LA. These are all common forms of methylphenidate. They also have an isomer form of Ritalin called Focalin, or Focalin XR, which is the longer form, which can also be used. D-amphetamine is the next most common, and you can also use amphetamine salts. as well as Adderall, which is also a type of amphetamine, and they have short and long-acting formulations. Adderall is actually more potent than Ritalin, so you start with smaller doses. There's also non-stimulant medication that can be used. A medication called atomoxetine is used, and that works on norepinephrine reuptake inhibition. It doesn't act as quickly as your stimulant medications would, but it can be used for kids that you're worried about them selling the medications for getting money, or they're selling them to their friends so that their friends can do better as well. That's really a big problem with Adderall. Also, Wellbutrin or bupropion is also a medication that's FDA approved for attention deficit hyperactive disorder. But again, this medication does not work as quickly as the methylphenidate Adderall medications do. What are the side effects of ADHD medications? Well, there's appetite suppression, weight loss. If you take it too close to bedtime, they won't be able to sleep, irritability, headaches. They can have some withdrawal phenomenon. Sometimes kids will get more agitated and aggressive in the afternoons once their medications wear off. Sometimes they will get more emotional when their medications wear off. These are things to look forward to. And occasionally it can cause tics or make tics worse.